When we say health policies, what are we talking about? Is there an overlap between the development of health policies and the faith community? And in a perfect world, what would that look like, Dr. Kennedy?
Mm, well, perfect world. Mm, that takes us right to glory, right? Because
Yeah.
we know that we know that in this world, um, we don't get the benefits of perfection. But I absolutely think there is an overlap between health policies and not just faith communities, but faith responsibilities. Like what is required of us as believers, and certainly among all those hats that I wear that you described. Thank you very much for that introduction. The leading hat is my hat as a follower of Jesus Christ. And so what are the responsibilities? That becomes the lens through which I see my assignment in the earth. And so we see health policy, particularly now, as a very, very broad construct. We used to think about health as sort of healthcare, hospitalization. Can you go to the doctor? But we now recognize, and public health has known this for um, generations since its inception, that the context of people's lives is really health policy. So, educational policy is health policy, community safety policy is health policy, policing policy is health policy, and all of those things contribute to the well being of others. And so, as we think about our faith lens, in my mind, we meet people at the point of their need, right? So those needs might look very different depending upon the characteristics of any particular community. So the health policy priority for Flint might look very different than the health policy priority for, say, Grand Rapids.